first and the relationships among them. And then part of the anatomy is the section which is defined as the careful cutting apart of body structures to study the relationship with each other. And then for physiology coined from the word physio, which means nature, and logi, which means study of. So it is the science of body functions. So because structures and functions are closely related, we will learn about the human body by studying its anatomy and physiology together. The structure of a part of the body often reflects its function. For example, our bones of the skull jointly tightly to form a rigid case which protects one of the very vital organs in our body, which is the brain, while the bones of the fingers are more loosely joined to allow a variety of movements. And in the walls of the air sacs in the lungs are very thin, permitting rapid movement of inhaled oxygen in the blood. So that's why the body parts and its function are closely related. And then these are the branches of anatomy. Much of this, you just have to familiarize, or you can screenshot this and read it by yourself because we just only have 1 hour for this. Okay, so the levels of structural organization and body systems is somewhat likens to other levels of organization of a language. Like for example, we have a letters, words, and then the words form sentences, and the sentences combined together will form paragraphs, and then a paragraph, a chapter, and then a book. Can be compared as well to the levels of organization of the human body, which from the smallest to the largest, we have a 6 levels of organization, which will help us to understand better about anatomy and physiology. And these are the chemical level, cellular level, tissue level, organ level, system level, and organismal level. So we will tackle each of these level. First, the chemical level. So this very basic level can be compared to a letters of the alphabet that includes atoms, which is the smallest units of matter that participate in chemical reaction. Which example of these are the carbon, hydrogen, and oxygen, and etc. And then molecules are includes a combined of 2 or more atoms. Which examples of these are your DNA, which is form of carbon, and then also your glucose is form of carbon, hydrogen, and your oxygen. Okay, so and then the next one for the cellular level is the molecules, in which the molecules combined together usually forms cells, which is the basic structural and functional units of an organization that are composed of chemicals. So just as a words, for example, the words are the smallest elements of the language that make sense. And then cells are the smallest living units in the human body. So there are actually types of cells. These are your muscle cells, nerve cells, and epithelial cells. And each of those cells have their own distinct characteristic, which we will discuss later further as we go along with our subject. And then the next level is the tissue levels. Tissues are actually groups of cells and materials surrounding them that work together to perform particular function, similar to the way words are put together to form sentences. And then there are 4 basic types of tissues. These are the epithelial tissues, connective tissue, muscular tissues, and the nervous tissues. The epithelial tissues, these are the tissue. This is a tissue that covers the body surfaces, the lines of hollow organs and cavity, and one forms glands. And then the connective tissue, these are the this connects, supports, and protects body organs. And then the muscular tissue, this is the one that contracts to make body parts move and generates heat. And the last one is the nervous tissue. It carries information from one part of the body to another through nerve impulses. And then the next one is the organ level. At the organ level, different types of tissues are joined together. So from the tissue, from the chemical, combine of chemical will form cells, and then it will combine.
Nawala.
Nawala yata yung connection.
Hello?
Yes po.
Nawala po.
Nawala
Yes,
po kayo
Doc.
kanina.
Nawala po.
I'm so sorry. Wait po. I lost. Dali lang po. Wait lang. Share screen. Advance. Portion of the screen. Share. Okay na po ba?
Yes, Doc. Yes, Doc.
So, hello po? Okay lang po?
Okay na po.
Okay. So, examples of this organ are, we have the stomach, skin, bones, heart, liver, lungs, brain, and etc. Okay, so for example, the stomach's outer covering is a layer of an epithelial tissues and connective tissues, which reduces the friction when the stomach moves and rubs against each other during digestion. And the others are the three layers of type of muscular tissues called the smooth muscle tissue, which is the one that contracts to mix foods and then push it to the next digestive organ, which is the small intestine. And in the innermost lining is an epithelial tissue, that layer that protects, which produces fluid and chemicals responsible for digestion in the stomach. So actually, the epithelial tissue lines both the inward and the outward portion of our stomach. So that's how the organ will form. That's a combination of two or more tissues. Because as I stated earlier, that we have four types of tissues. One of these is epithelial tissue, and then the connective tissue. So in order to form stomach, we have a epithelial tissue and a connective tissue, as well as a muscular tissue. So that's as well, kagaya din yan sa other na organs ng ating katawan. So that's it. And then the next one, the fifth level, is the system level. A system or a chapter in our language analogy consists of a related organs or paragraph with a common function. Example of which is our digestive system, which actually breaks down food and it absorbs. So included of this digestive system is our mouth, salivary glands, pharynx, and so on and so forth. Even the liver, gallbladder, and pancreas, which also functions in other system. Like for example, our endocrine system. That's why. So meaning to say, our system is an integration of different organs that make in order to function in the function that they are needed in our body. So a combination of the system, we will be forming an organismal level. So this is already, it constitutes all parts of the human body. So this is the perfect illustration of what I'm saying, the 6 levels of organization in the human body. For example, so this is the chemical levels. We call it composed of DNA molecules, and then combined of this will be forming cellular level. We have smooth muscle cell, for example. There could be a nerve cell, nervous tissue, and then after a combination of these, we'll be forming a tissue, and then a group of tissue, we have epithelial tissue, smooth muscle tissue, epithelial tissue again. So we'll be forming an organ. And a group of this organ will be forming a system, and then a group of this system joining together and function have interrelated function will be forming an organism. Example of this is us humans. So actually, although we will be discussing this as we go along with our subject, we will have an overview in various system in our body. So we have actually 11 systems in the human body. We have the integumentary system, which includes our skin, the hair, fingernails, toenails, sweat glands, and oils, which functions to protect our body, which help to regulate body temperature. And it helps also in making vitamin D. Okay, and also it serves as our sensation for touch, for pain, for warm and cold, and etc. And then another system is the skeletal system, which includes the bones and the joints, as well as the cartilage, which functions to support and protects body, to provide surface area for muscle attachment, and it aids also in our movement. Okay, and it stores minerals and lipids as well. So another system is the muscular system. So it includes the skeletal system, skeletal muscular tissue, which is the muscle usually attached to the bones, and it functions. It participates in body movements such as walking, and it also produces heat in times when we need heat production. And another system is the nervous system. It includes the brain, spinal cord, the nerves, and the special senses organ, which is the eyes and the ears, which functions, which generates action potential or nerve impulses to generate body activities, detects changes in body's internal and external environment, and interpret changes and response by causing muscular contraction or glandular secretion. So please bear with me, because as we go along with our subject, I'm going to discuss is more detail, okay? And then the next is the endocrine system, which includes a lot of glands. We have the pineal gland, hypothalamus, thymus, thyroid, and etc. And its function is to regulate body activities by releasing certain hormones, okay? And then the next one is, of course, we're all familiar with this, of the cardiovascular system, which include the blood vessels, the blood, and the heart. So the function is that the heart pumps blood to the blood vessels, and the blood carries oxygen and nutrients to cells and carbon dioxide and waste away from cells, and helps regulate acid-base balance, temperature, water content of body fluids, blood components, help defend against disease and repair damaged blood vessels. So the next one is our lymphatic system and the immunity. This includes the lymphatic fluids and the vessels, the spleen, the thymus, the lymph nodes, the tonsils, which of course the function is in order to protect the cells against foreign invaders. The next one is our respiratory system, which includes the lungs, the air passages, such as the pharynx, the larynx, the trachea, and the bronchial tubes, as which function, of course, in order for the oxygen to enter in our body and to help in our metabolism. So the next one is digestive system, which includes the organ of the gastrointestinal tract, the mouth, the esophagus, the stomach, the small intestine, up to the anus, which also includes the salivary glands, the liver, the gallbladder, and the pancreas, which achieves physical and chemical breakdown of foods and absorbs nutrients and eliminates solid waste. And the next one is our urinary system, which includes the kidneys, ureters, urinary bladders, and urethra, which functions to produce, stores, eliminates urine, eliminates waste, and regulates the volume and chemical composition of blood, helps maintain the acid-base balance of body fluids, maintains body's mineral balance, and helps regulate production of red blood cells. And then the last one, of course, is the reproductive system, which of course includes the testes for the male, ovaries for the females, uterine tubes, which is the fallopian tube, the uterus, the vagina, so on and so forth, which function to produce gametes that unite to form new organisms. Which also, these gonads also will release hormones that regulates the reproduction and
Nawala na naman.
so the non-invasive diagnostic is involved. This is how we're going to detect, we're going to detect those tissues or those organs that we just mentioned earlier. But when we say non-invasive diagnostic this technique, it does not involve insertion of an instrument or device to the skin or body opening. So technically speaking, walang instrument na mapasok sa loob ng katawan natin even through skin. Okay, one of these example of there is an ultrasound that's one of the non-invasive diagnostic technique. But there are four basic non-invasive diagnostic techniques. These are the inspection, palpation, auscultation, and percussion. These are the physical examination, the non-invasive diagnostic technique that usually medical practitioner would use in order to assess the patient, in order to arrive at certain diagnosis. For example, inspection is that the examiner observes only the body without even touching it, only through the eyes, what you see only. Okay? For example, you see that the patient is yellow already. You see that the patient is reddish. You see that the patient has a lot of wounds. But when you say palpation, the examiners already feels body surface with the hands. So you're going already to touch the person's body. For example, you feel that there is the mass, or you feel that the body temperature, that the person is quite hot. Okay, and then the third one is the auscultation. Of course, auscultation, the examiner already listens to body sounds. Usually, it uses the stethoscope in order to listen to the sound of the heart, whether there are abnormalities or the sounds of our lungs, or even in our bowels. And then the last one is the percussion. The examiner taps on the body surface with the fingernails and listen to the resulting sounds. For example, I'm going to tap to your stomach, whether we will notice if you have abdominal bloating or not, and then we're going to tap as well certain areas of your body so that we can identify if there are really enlargement of your organ, for example, especially for your liver. So these are the four basic non-invasive diagnostic technique that usually medical practitioner would use in order to assess certain patient. Characteristics of the living organism, because there are certain processes which distinguishes an organism or living things from non-living things. So following are the 6 most important life processes of the human body. One of these is metabolism. So what is metabolism? I know that you also hear that word. Metabolism is the sum of all chemical processes that occur in the body. And there are 2 phases of metabolism. These are the catabolism or anabolism. Catabolism, coined from the word kata, means throwing down, and ism, a condition. So catabolism is the breaking down of a complex chemical substance into a simpler components, while anabolism comes from the word ana, which means raising up. So meaning, anabolism is the building up of complex chemical substances from smaller or simpler component. Okay, for example, one example of this is as our digestive system. For example, our digestive system, we're going to eat certain food, it will undergo process of breaking down, which is catabolism. And then during absorption, of course, that example of the protein will be catabolized into a simpler component, which is the amino acids. And then that amino acid will be absorbed in our body. And then during absorption, our muscles, our bones will uptake that amino acid, and it will be go into process of anabolism, or the building up of those amino acid into protein. Okay, so that's one of the examples of the process of the metabolism. Next is responsiveness. Responsiveness is the body's ability to detect or respond to changes. For example, if there is an increase in body temperature during a fever, represent a change in the internal environment within the body. For example, if you hear that a sound of a if there is a danger or an alarm, you will turn to the alarm in order to protect the body for the certain threat that might occur. So the different cells in the body respond to environmental changes in different characteristics. For example, the nerves respond by generating electrical signals known as nerve impulses or action potentials. And then muscle cells usually respond by contracting, which generates force to move the body. Okay, that's responsiveness. The next one is movement. Movement includes motion of the whole body, individual organs, single cells, or even tiny structures inside the body. For example, the coordinated action of our leg muscle usually allow us to walk or to run. And then other example is that after we eat certain fats, usually our gallbladder would contract. That's also a movement in order to release the bile and to digest that fat that we intake. And another example is the white blood cells in our body. Like for example, they move during infection in order to engulf, in order to kill that infecting organism in our body. So that's one of the examples of the importance of movement in our body. And then another one example of it is the sperm cell, because without movement there is no production that will occur as well, because if there is dysmotility with the sperm. And then another one is the growth. Growth is an increase in the body size that results from an increase in the size of existing cells, an increase in the numbers of cells, or both. So growth can occur either there is increase in the existing number of cells, or there is an increase of the size of the cells as well, or either both. So if there is increase in the number of cells, that's what we call hyperplasia. But if there is increase in the size of cells, that's what we call hypertrophy. Okay, so both are increased, but if it pertains to number of cells, that's what we call hyperplasia. If the size will increase, that's hypertrophy. And in some instances, some increases in size because of amount of material between cells, like for example, the growing bones, especially in children and adolescents. And then the next one is differentiation. Differentiation is the development of a cell from an unspecialized to specialized state. One example of this is the stem cells, because stem cells are precursor cells which can divide and give rise to cells that undergo differentiation. Because actually this differentiation is very much important, especially in preventing cancers, especially leukemia, because in leukemia there is abnormality in the differentiation wherein the stem cells cannot differentiate further into a mature cells, causing them to go into malignant transformation. And then another one example for this, and then please take note that each type of cell in the body has a specialized structure and function that differs from that of its precursor cells. So meaning to say that there are times that even though that they have the same stem cells in the origin, but as long as along the process of maturation or differentiation rather, they will develop into a distinct or different type of cells. Like for example, in our blood, we have the red blood cells, white blood cells, and platelet, right? But actually, those three type of cells, they came from the same stem cells, from the pluripotent hematopoietic stem cells, which actually differentiate further into three specific type of cells, which have also a distinct function in our body. So another example of differentiation as well is that a single fertilized human egg or ovum developed into an embryo, fetus, infant, child, and finally adult. Okay. The last one of these characteristics of the basic life processes in the human body is the reproduction. Reproduction is the formation, reproduction actually is either formation of new cells for growth or repair or replacement. That's what we call cell division. Or it can be production of a new individuals from, of course, through fertilization of an ovum by a sperm cell to form zygotes, followed by a repeat cell division and differentiation of these cells in order to form fetus. Okay, so that's what fertilization, if there's a production of new individuals. And then please note that any disruption of these life processes can result to death of cells and tissue, or eventually would lead to death of the organism. And then clinically, when we see death, there should be a loss of heartbeat, cessation of heartbeat, cessation of spontaneous breathing, and loss of brain function. So that's how we can see that the patient is already dead. Now we proceed to homeostasis. So what is homeostasis? Homeostasis, by the way, came from the word homeo, means sameness, and stasis, which means standing still. So homeostasis is a condition of equilibrium or balance in the body's internal environment due to the constant interaction of the body's main regulatory processes. So it responds to changing conditions. The body's equilibrium can shift among points in a narrow range that is compatible with maintaining life. For example, there are a lot of changes that our body experiences every single day. So because of homeostasis, our body will tend to maintain homeostasis through various regulatory systems that we'll be tackling later. So, and then an important aspect of homeostasis is maintaining the volume and composition of body fluids, which is the dilute and watery solution containing dissolved chemicals, for example, sodium, potassium, or what we call as electrolytes, that are found inside the cells, as well as those surrounding them. Then actually there are two compartments of our body fluids. These are the ICF, or the so-called intracellular fluids, or the ECF, which is the extracellular fluid. So with regards to extracellular fluids, we have if the extracellular fluid is found within the blood vessel, that's what we call blood plasma. If that is found within the lymphatic vessel, that we call the lymph, or it is found within the brain or the spinal cord, it's a cerebrospinal fluid. Or within the joint is the synovial fluid. Or within the eye, it is called aqueous humor or vitreous humor. So technically speaking, the intercellular fluid, those are the fluid really within the cell. And then the extracellular fluid, those are the cells, those are the fluid outside the environment of the cell. And then one of those, and this extracellular fluid is further divided into interstitial fluid, which fills the narrow spaces between cells of tissue. And then the proper functioning of body cells depends on the precise regulation of the composition of the interstitial fluid surrounding them, because interstitial fluid is the internal environment of our cells. So technically speaking, if medyo naguguluhan kayo, the interstitial fluid really is part of the extracellular fluid. It's just that the extracellular fluid really would localize only into one compartment. For example, in the blood vessels, the blood plasma there, that's the part of the extracellular fluid. But your intracellular fluid, those are fluid which is really directly surrounds our cells. Okay. So and then there are homeostasis in the human body is continually being disturbed. Some disruption come from the external environment, for example, intense heat during summer or lack of oxygen if you're going to run, or disruption either through internal environment, such as a drop in your blood glucose because you skip your meal, and so on and so forth. But so that is why we have this. Fortunately, our body has many regulating systems that can usually bring the internal environment back into balance, despite those disruptions that might occur in our body. And then most often the nervous system and the endocrine system work together or independently to provide the needed corrective measures. And then actually the nervous system regulates homeostasis by sending again. If we'll be talking about nervous system, we will be dealing much more about nerve impulses and action potentials to organs that counteract changes from the balance state. But and then this nervous system is quite rapid. Mas fast pa siya. Mas faster. And then another response is the endocrine system, which includes many glands that secrete messenger molecules called hormones into the blood, but it is much lower compared to nervous system. And then with regards also, the body can regulate its internal environment through many feedback systems. So feedback system is a cycle event in which the status of a body condition is monitored, evaluated, monitored, evaluated, changed, remonitored, evaluated, and so on and so forth. It is a cycle. And then a feedback system includes three basic components, which are the receptor, control center, and an effector. What is a receptor? A receptor actually is a body structure that monitors changes in a controlled condition and sends input into the control center. So this pathway is called a afferent pathway. Since the information flows toward the control, going to the control center. So if you hear the word afferent, the afferent is going to certain, like for example, going to certain direction, going to the goal. That's afferent pathway. So typically the input is in the form of nerve impulses or chemical signal. For example, certain nerve endings in the skin detects temperature and can detect changes such as a drop in the temperature, which the receptors will send input to the control center. And then that control center specifically, for example, the brain set the range of value within which a controlled condition should be maintained, and then evaluate the inputs received from the receptors and generate certain output in order to counteract the condition that occur in your body. So this is called the efferent pathway already. You are sending away information, okay, from the control center. So in our skin temperature, for example, the brain acts as a control system, receiving nerve impulses from the skin receptors and generating nerve impulses as an output. And then the last one of this part is it's an effector. An effector is a body structure that receives output from the control system and produces a response or effect that changes the controlled condition. Nearly every organ of the tissue in the body can behave as an effector. For example, your body temperature drops sharply, your brain or your control center sends nerve impulses or output to the skeletal muscle, which which will be your effectors, thus result in shivering in order to generate heat and raises your body temperature. This illustration would show us of how our the operation of our feedback system. We have here a stimulus, for example, increase in heat. That's a stimulus, and we have a controlled condition. For example, we need to control our body temperature at a certain level. And then this is being monitored by our receptors. For example, for the heat. So it is being constantly monitored by the receptors, which sends input. For example, there is heat. Our skin detects that there is an increase in heat or a drop in temperature. So what happens is that it sends input into the control system, saying to the brain, hey, there is a decreased temperature in the surrounding. So what this control center will send an output signal to the effectors in order to bring back the normal condition of your body or the normal temperature of your body, thus resulting into shivering in order to increase your body temperature. That's how the feedback system in our body works. And actually, there are two types of feedback system in order for you to understand more. We have the negative feedback system, the positive feedback system. Okay, so this system really works the way kanina. Dapat may receptor talaga, tapos may control system, and then may effector siya. For example, what is this negative feedback system? Negative feedback system, it reverses a change in a control condition. For example, I hope it can be seen, no? So this is an example of a negative feedback system. For example, there's a stimulus which disrupts stimulus by increasing. So and then there is controlled condition your blood pressure. So technically there is a sharp increase in your blood pressure. And then you have the receptor found in your blood vessel, which is the baroreceptors, which detect that there is an increase in blood pressure in your body. And then this receptor, the baroreceptors, for example, will send a nerve impulse or an input to your brain saying that there is an marked elevation of the blood pressure in our body. So this control system of your brain will send a nerve impulse or an output into your heart or even to your blood vessels to dilate your blood vessels in order to bring down your blood pressure into normal. Okay, that's the negative feedback system. For technically speaking, our body would tend to decrease our blood pressure into normal if there are cases that if there is sharp elevation of our blood pressure. Another example of that is the increase in our blood glucose. For example, if there is increase in blood glucose level in our body, if there is decrease in blood levels in blood sugar in our body, there is increased secretion of our glucagon in order to produce a lot of glucose in our body. But in times with there is already increased enough amount already of glucose in our body, our control system will send negative feedback system into our pancreas in order to stop the production of the glucagon because there is already enough glucose in our body. And instead of that, it will also secrete insulin again. And then if in cases that the glucose already dropped to normal na, so the feedback system, the negative feedback would send again impulse output into the pancreas to stop the production of insulin because the glucose already is normalized. So that's how the negative feedback system works. And then the positive feedback system is the opposite. The negative feedback would halt or would stop the reaction. The positive feedback will strengthen or reinforce a change in one of the body's controlled condition. So for example, the best example for this is that during contraction. So we know that if there is, of course, there's a symptom that there is contraction. the more that there's contraction, the effector will tend, our control center or the brain would release more output to stimulate to enhance the contraction of the uterus in order for the expulsion of the fetus. And that's one of the great example of positive feedback system. But actually, mind you, that our body usually use frequently use the negative feedback system, because most in our system we don't like the positive feedback system, because positive feedback system is quite detrimental in our body. Like for example, if our body mostly use the positive feedback system during increase in blood pressure, so technically speaking, he will further increase the blood pressure. So it would leading to detrimental effect in our body. So that's why mostly our body will use the negative feedback system. Okay, and then if you are familiar with the word sepsis, during time of sepsis, the one that will work in our body is the positive feedback system. So it further harms our body. Okay, so with regards as well to, if now we'll proceed to the hemostatic balance. Actually, there are a lot of factors why certain individuals suffer from various diseases or from various imbalances in homeostasis, because there are really a lot of factors for health. One of these is the environment, and of course our own behavior. Next is our genetic makeup, that wala tayong magagawa dyan sometimes, and then the air that you breathe, the food you eat, and even the thoughts that you think. If we're going to look at the factor of the health, we can say that 2/3 of this is modifiable. Only 1/3 of this is non-modifiable. So there is really high chances for us, if we're going to practice healthy lifestyle, there is really a greater chance for us to live longer and to live a healthier life. So one example of having an homeostatic imbalance is having a disorder. What is a disorder? It is any abnormality of structure or function in our body. And then if there is already disease, the disease is a more specific term for an illness characterized by a recognizable set of signs and symptoms. And then it can be local or a systemic disease. So what is a local disease? Of course, a local disease only affects one part or a limited region of our body. For example, you only have a wound. So that's a local disease. It affects only one part of your body. So or a systemic disease which affects either the entire body or several parts of the body. For example, diabetes. It affects all organs of your body. And then these diseases usually has a manifestation or clinical manifestation. And this clinical manifestation is divided into signs and symptoms. Now we will tackle the difference between symptoms and signs. So symptom is a subjective changes in body function that are not apparent to an observer. So technically speaking, it is only the patient who feel the manifestation. So in comparison to sign, it is an objective changes that a clinician or a person can observe or measure. For example, pain. Pain is a symptom because we cannot feel the pain. Only the patient can feel the pain. That's the example, a great example of a symptoms. While the sign, example of sign is a wound. You can see the wound, right? Or a mass or a tumor, you can feel it. Or for example, use a jaundice or a yellowing of skin, you can observe that. A rashes, that's a sign. That's an example of a sign. Okay. Now part of the, and then part of this that we're going to define epidemiology. So what is epidemiology? It is the science that deals with why, when, and where diseases occur and how they are transmitted among individuals in the community. Because epidemiology is of hemostatic occur and how it is transmitted in order to control further damage in our body. And then, of course, when we deal with hemostatic imbalances, we need sometimes medication in order to halt further damage in our body. It is a science that deals with the effects and uses of drugs in the treatment of a disease. So for our clinical application, for diagnosis is a science and skill of distinguishing one disorder or disease from another. So the basis for making diagnosis are patient signs and symptoms, as what I've discussed earlier. Medical history. So what is medical history? We're going to ask questions about what happened to the patient before the patient came in to your clinic or to you for check-up or physical examination. That's already what when you will perform the inspection, palpation, percussion, and auscultation. That's physical examination or a laboratory test, which we need mga special studies for this. Okay. Now, we're almost done. In order for us to understand more as we go along with our study, we will be discussing basic anatomical terminology so that you will no longer be confused with the term that I'll be using later as we go along with our subject. Okay, so what is an anatomical position, by the way? Anatomical position is this is the definition of anatomical position. The subject stands erect, facing the observer with the head level and the eyes facing directly forward. And then the lower limbs are parallel and the feet are flat on the floor and directed forward, and the upper limbs are at the side with the palms turned forward. So I hope you can imagine, because it is quite better if it is face to face, no? So another variation of our anatomical position is the prone position or the supine position. A prone position is lying face down, and in a supine position, body is lying face up. Okay, so this is an example of a great example of an anatomical position. See, so this is the anterior view. If this is the patient is lying, this is the supine position, and this is the prone position, face down, and then this one is the face up. So as well as in our please be familiar with the medical terms that is stated here. Like for example, our head or the skull, cranial, the face, the facial, the neck is the cervical, armpit is the axillary, the arm is the brachial, the front of the elbow is the antecubital. Please be familiar of this na lang self-study so that you will no longer be confused as we go along with our subject. Okay? So now we proceed to the basic anatomical terminology. Specifically the directional terms. Directional terms, words that describe the position of one body part relative to another. For example, these are our directional terms. The superior, inferior, anterior, posterior, medial, lateral, intermediate, ipsilateral, contralateral, proximal, distal, superficial, and deep. So please study na lang this so that when we say superior, is that towards the head or the upper part of a structure. So the heart is quite superior to the liver. So actually, if you're going to define this, the basis for the definition of term wala.
Choppy.
So on and so forth. Please just screenshot na lang because medyo malapit lang yung time. So like for example, in this next slide, In the next slide, for example, so this is your distal, proximal, the medial is the median, the medial is going to the middle, the lateral is going to the side, and then superior, of course, above, the inferior is below. So, for example, your heart is actually superior to your liver, but your liver is superior to your stomach. Okay, and then the stomach is inferior to the liver. So that's how is it. And then this one, your finger, your phalanges is this one is the distal, and then going to the center is the proximal. Okay. Now we're going to define the planes and section. When we say sagittal plane, you hear sagittal plane. This is the vertical plane that divides the body or an organ into right or left side. That's it, right or left side. That's the sagittal plane. I have an image later. And in the mid-sagittal plane or the median plane, this is the plane which passes the midline of the body and divides the organ or body into right or left side. Okay? Midline. And the parasagittal does not pass the midline, but instead divide the body into an equal right and left side. So technically, the difference, the sagittal only divides the mid sagittal parasagittal belongs to the sagittal plane. But if we say mid sagittal plane, there is an equal division. The midline, there is the division. The body will be divided equally left and right. But when you say parasagittal, it is unequal division because it does not pass through the midline. And then when we say frontal or coronal plane, it divides the body or an organ into anterior and posterior portion, front and back. Of course, bearing in mind that we are defining this basing upon that the body is in anatomical position. Transverse plane divides the body into superior and inferior portion later. So and then the above mentioned plane are actually divides the body into a 90 angle, 90 degrees angle, while the oblique plane passes through the body or an organ at an oblique angle more than other than 90 degrees that other 90 degrees angle. This one, see, this is an example of our. This one is the mid or the median plane or the mid sagittal plane. We divide the body into an equal right and left side or right and left side. And this one is the parasagittal plane. We just only divide the body into right and left, but it is unequal. Okay. And then this one is the oblique. It's not 90 degrees angle. And then this one is the transfer plane. We just only divide the body into superior and inferior or above, below. And then the coronal view, this one is the coronal, the frontal view. We just only divide the organ into an anterior or posterior. Okay, so this is the anterior of the brain, and the back one is the posterior portion of the brain. So this one is the coronal or the frontal plane. Okay. And then now we're to the different body cavities. Body cavities are spaces that enclose internal organs. And one of these body cavities, we have the cranial cavity, which is cranial bones, in which the cranial bones form a hollow space of the head, which encloses the brain. Or we have the vertebral canal, which is enclosed by the vertebral column, which contains the spinal cord. And our brain and these cavities are lined by the meninges. These are the 3 layers of protective tissues of the brain and spinal cord. And by meninges, we have 3 layers of the meninges. We have the dura mater, arachnoid mater, and the pia mater. That's from the outside from outer to inner. So the outermost layer of the meninges is the dura mater, and then the middle is the arachnoid mater, and the pia matter, which is the direct lining within the spinal cord and our brain. The next one is the thoracic cavity. It is formed by the ribs, the muscles of the chest, the sternum, and the thoracic portion of the vertebral column. Example, the more specific area of the thoracic cavity, we have the pericardial cavity, which is a fluid space that surrounds the heart, or the pleural cavity, with fluid space around each lung. And again, we have the mediastinum, the central part of the thoracic cavity. It is between the lungs, which extends from the sternum to the vertebral column and from the first rib to the diaphragm. This one. This is an example of our thoracic cavity. So this one is our mediastinum, this one, and then this one, or the purple lining, that's our pleural cavity. This one is the pleural cavity, and then the orange one, that's our pericardial cavity. Okay, and then this one, the center, the blue one, that's the mediastinum. And these are the organs that we found in each of these cavity. So of course, within our pericardia, we have the heart, and in our pleural, we have the lungs, and the mediastinum, we have the aorta, the trachea, so on and so forth. We will discuss it further, don't worry, as we go along with our subject. Next is the diaphragm. Diaphragm is a dome-shaped muscle that separates the thoracic cavity from the abdominopelvic cavity. And the abdominopelvic cavity extends from the diaphragm to the region and is encircled by the abdominal muscular wall and the bones and the muscles of the pelvis. So abdominal cavity, of course, the abdominopelvic cavity, from the word abdominopelvic cavity, is divided into abdominal cavity, which is the superior portion of the abdominopelvic cavity, and the pelvic cavity, which is the inferior portion of the abdominopelvic cavity. And when we say viscera, viscera is the organ itself without the surrounding structure. For example, the heart alone without the pericardial cavity, so on and so forth. And then the thoracic and abdominal cavity membrane. So this membrane, actually, in any cavity, membrane is a thin, pliable tissue that it covers, which lines and partition or connects structures. And an example of this membrane is the serous membrane, which is a slippery, double-layered membrane associated with body cavities that does not open directly to the exterior, which covers viscera or the organ and lines the wall of the thoracic and abdomen. And then we have two types of serous membrane, or two layers rather of serous membrane. We have the parietal layer and the visceral layer. The parietal layer is the thin epithelium that lines the walls of the cavity. For example, it lines the thoracic cavity, while the visceral layer, this is the thin epithelium that covers or adheres directly to the viscera, to the organ or to the heart, and adheres to the viscera within the cavities. And between the parietal layer and the visceral layer, we have the serous fluid, which lubricates. It's a lubricating fluid that allows the viscera to slide during movement, thus protecting it from injury. Type of serous membrane, we have the pericardium, peritoneum, and in the pericardium, it is seen within the pericardial cavity, and the peritoneum, of course, in the abdominal cavity. And we have as well mga retroperitoneal organ. These are the retroperitoneal organs, the kidneys, adrenal glands, pancreas, duodenum, ascending and descending colon, portion of the abdominal aorta, and inferior vena cava. So these are the example, no? This is an illustration, a great illustration of our different cavity in our body. So if you can imagine, so this is the diaphragm dividing the thoracic cavity and the abdominal cavity, abdominopelvic cavity rather. And in the abdominopelvic cavity, the superior portion is the abdominal cavity, which is surrounded by the membrane, so-called the peritoneum, and then the pelvic cavity. This is the pelvic cavity. Okay. and then the cranial cavity and the vertebral canal, which contains the brain and the spinal cord. And the brain and the spinal cord is lined by the meninges. The meninges is composed by the dura mater, pia mater, arachnoid mater rather, and the pia mater. And if you're curious with regards to the cerebrospinal fluid, that's our cerebrospinal fluid located between our dura mater and our arachnoid mater. That's what we call, no, between, yeah. And then we're almost done. So now let's proceed to the abdominopelvic regions and organs. So what are the regions in our body, or especially in our abdomen? The regions are the two horizontal and two vertical lines partition of the cavity into 9 regions. So these are the regions, the abdominal regions. We have the right hypochondriac region, the epigastric region, the left hypochondriac region, the right lumbar region, the umbilical region, the left lumbar region, the right inguinal region, hypogastric region, the left inguinal region. So you might ask why is it very important in the medical profession? It is very important because in each of these regions there are specific organs that is found in that certain area. So for example, if there is pain located in that area, you have already certain in mind that there are possibility that certain organ is being injured. Okay, for example, here usually you in case of appendicitis, we can feel the pain here in the right area of our abdomen. So because that's the usual location as well of our appendix. So this is our appendix. And then if you notice here, if you have something problem with your kidney, you'd notice that you might feel lumbar pain because that's the location of our kidney within the lumbar area. Okay, and then if, for example, our stomach is located in the epigastric region, so that is why in cases of stomach ache or gastritis, we feel the pain in the epigastric region. So this is the importance of dividing the abdominal area of our body into regions. So be familiar for this region because you will be hearing this term as we go along with our subject. So quadrants. This quadrant, it is a mid-sagittal line and a transverse line are passed through the umbilicus. We will only divide the stomach into 4. This is the mid-sagittal line, right? And this is the transverse. So we just only divide the stomach into right upper quadrant, left upper quadrant, right lower quadrant, and then left lower quadrant. So for example, the patient will come to you experiencing right lower quadrant pain. So technically, the doctor would really think, what are the organs located in the right lower quadrant? So one of the most common is the appendix. So technically, maybe the patient has appendicitis. So the doctor will request tests in order to rule in the possibility of appendicitis. Or in cases for gallbladder stone, cholecystitis. So technically speaking, the area the pain in your stomach that you feel is within the right upper quadrant because that's where the gallbladder is located. Of knowing about this quadrant in order for us to localize further what specific organ is damaged or affected in certain diseases. So I guess that's all for our lecture for tonight. Any question? I hope you can. I hope just please review na lang because I know it's not that easy for the first timers.
Maraming salamat Doc J. Talagang marami talagang mga terminology na dapat talagang ipa-familiarize para may tanong lang po ako Doc J.
Yes.
Yung sa placement ng mga internal organs katulad ng liver, hanggang sa pababa ng mga internal organs. Bakit po? May explanation po ba ang science niyan kung bakit nasa superior talaga yung liver kaysa doon sa isang internal organ?
Parang wala akong
Yung pangalawang
with regards to that, sir, parang wala akong nabasa kung bakit ganyan siya.
okay
Why that organ located to that superior to that.
yung pangalawang
because
tanong ko po. Yes po.
Ano pong pangalawang tanong?
Yes po, yung pangalawang tanong ko po ay bakit po na mag-stop po ang heart beating pag ang isang tao ay mamatay?
Technically speaking, there are times that actually in the field of medicine, we can either pronounce a person dead already, even if there is still heartbeat, because sometimes in medicine, most patients already in brain death, we consider that as already dead, even if there's a heartbeat, because we entertain that the heartbeat is already being manipulated by stimulated by the drugs that we give. But if the question is, why is it that usually without treatment, without any medication, why is it that if there is brain death, the heart will stop its function? Because technically, there are a lot of chemicals that our brain would send into the heart in order for it to pump. Yeah.
So may posibilidad po ba na patay yung utak pero buhay yung heart?
Pwede siya, pero dapat may medicine. Pero kung wala, patay talaga siya.
Okay.
Kasi hindi mag-pump hindi magpa-pump yung heart na yan eh. Tapos yung heart pa naman, although hindi siya magpa-pump eh, kasi wala nang oxygen eh. Kasi kapag during brain death, kapag wala talaga na, wala na din yung breathing, tapos ilang minute na yan so follow yung heart, wala din. Kasi
so may
posibilidad. Yes po.
May posibilidad po ba na mag-malfunction yung isang system sa ating katawan? May posibilidad po ba siyang buhay pa siya kung may isang system na mag-stop sa pag-function?
Kung yung system na yun hindi siya talaga, example sa heart, even if the heart will malfunction, for as long as it will be detected right away. So that's again later on in our pathophysiology, if you will deal more of the specific system in our body, we will understand why is it important, why pwede siya, pero dapat may mga intervention talaga. Kasi if removing the power of medicine, wala talaga.
Okay.
Even if, for example, if your heart will malfunction severely, because in every malfunction there is mild, moderate, severe. But if it is only mild, our body will maintain homeostasis as much as possible. Our body, that's the normal response of our body. It will really maintain homeostasis. But to maintain homeostasis of our body, the heart will need help from the kidney. Then especially the kidney. The heart will need help from the kidney as well as from the intestine, or even our brain, signaling our intestine that please do not supply much more of the blood in the intestine, because we need to limit the delivery of oxygen there, so that we will limit the workload of the heart. Or that's how our body works eh. Pero if there is severe malfunction of the heart, of course, there is no pumping already of of enough blood, of oxygen to the kidney, to the various organ. Of course, the patient would eventually die without treatment. But if there is heart transplantation, of course, the patient will die, will live.
Okay. Kasi may recent news po kasi yung last year pa ata na yung isang tao may may heart failure tapos kinuha yung heart niya tapos pinalitan ng heart sa baboy. Na possible po ba 'yon talaga?
Possible siya talaga. That's the ongoing research now. Possible siya, pero I guess na-fail ata yun. It was not a success, yung transplantation. Pero I don't know kung... Pero actually yun kailangan pa yung dadaan ng research talaga para ma-proven talaga siya na effective siya
Sa bagay, namatay siya pagka dalawang buwan ata or ilang araw.
Namatay siya.
Namatay siya. Maraming salamat talaga Doc J. So ibigay ko na po kay Doc Ray, baka may po siya, may karagdagang katanungan or additional inputs po sa pag-aaral natin ngayon.
Yung mga i-review nyo lang yung mga anatomical terms na siguro, saka yung mga terms, kasi dadaanan talaga yun as we go along with the subject
Yes po, yes po. Doc Ray. Silent po si Doc Ray. So siguro maraming salamat po Doc J sa yung oras na ibinigay sa amin. Talagang hinintay po namin yung yung subject mo dahil malaking tulong po talaga itong patungkol po sa science, lalo na dito sa pag-aaral ng anatomy. So maraming salamat po talaga Doc J. Tulog na po yata si Doc Ray. Yes po. Mga kapatid, may sasabihin po ba kayo kay Doc Jansin?
Sir Aris, may tanong ko kay Doc.
Yes po, yes po.
Doc?
Yes po.
May nabanggit po kayong hyperplasia, maaaring ipaliwanag sa layman's term yung yun at saka saan region ng katawan nararamdaman?
Hyperplasia po, yun yung sabi ko kanina, if sa growth kasi sir, either hypertrophy yan or hyperplasia Kung sasabihin natin hyperplasia, ang cells kasi natin, pwede yung dadami or pwede yung lalaki. So kung sasabihin natin dadami siya, that's the term there is hyperplasia. Pero kung lalaki lang ang cells, hindi siya dadami, that's what we call hypertrophy. So example, there are certain areas in our body wherein it will only grow through hypertrophy. Example for that is our skeletal muscle and as well as our heart. When our heart becomes big, or the so-called cardiomegaly in the medical field, the increase in the size and the increase in growth of the heart is brought about by hypertrophy. Increase in the size of your myocytes, of your hearts, of your heart muscle. But if we talk about hyperplasia usually occur in those areas of our body which has the ability to regenerate. For example, our liver. In cases of lobectomy, our liver will restore its own size through hyperplasia. So there is increase in the number of its hepatocytes or liver cells. But in cases of pregnancy, the uterus or yung matres po, it will work too. It will work through both, through hypertrophy and through hyperplasia. So technically, dadami yung mga muscles ng uterus at saka lalaki pa sila. Yun, sir.
Okay. Hindi siya yung inflammation, Doc. Iba po yun.
Yung inflammation po, hindi po. Kasi yung inflammation po, it will occur if in cases of there is already insult eh.
Okay.
Sometimes, yeah, even the hypertrophy and hyperplasia will occur during insult as well. Pero yung inflammation kasi may mga inflammatory cells na yun eh.
Okay.
Oo. And I
Okay,
guess we'll
Doc,
be tackling
salamat.
that later sa pathophysio eh.
Maraming salamat, Doc.
Sige po.
May connection po ba siya, Doc Jay, sa sa mga tumor?
Yes po, meron siya. I guess madidiscuss natin yan sa pathophysio later on
Okay po.
as we go along with our topic.
Okay po, thank you po. May mga katanungan pa ba ang mga classmate natin dito?
Pwede po kasi parang next subject ko parang medyo ang gulo eh. Technical siya eh.
Hello, Doc Ares.
Yes.
Pwede ba tayo maka-avail ng copy ng books o para mayroon tayong mababasa na na libro?
So depende na po yan kay Doc Jane kung i-share po niya sa atin yung presentation niya or yung book na pinagkuhanan niya ng information. So nasa kanya na po pag kung i-share niya sa atin.
Okay, thank you.
Okay lang naman. I can share.
May mga katanungan pa po ba?
Doc Jan, yung anatomical position ba yung sa pharmacon na advertise?
Hindi ko po hindi po nakita yung anatomical position ng puset, parang tumayo ka lang talaga. Kasi yung anatomical position po sir, sa yung anatomical na sinasabi natin, yun yung exact na position ng body kapag ini-examine talaga sa or kapag identify natin yung mga organs niya. Parang by standing position lang siya naka-erect, tapos yung palm niya is nakaharap.
Okay. Noted po, noted. Thank you, Doc.
Sige po. Kasi kapag hindi natin ginagamit yung anatomical, kapag hindi sila gamit ng anatomical position kasi, ang hirap kasi, there will be confusion as to where that certain organ will be located, whether it is superior ba talaga o inferior. Kaya nag-define talaga ng anatomical position. Kaya para may unity, may universal na area kung saan talaga siya nakikita, kung sino talaga yung superior, at saka para ma-identify natin yung anterior at posterior at saka superior at inferior.
Noted po, Doc.
May mga tanong po ba mga kasama natin kasi 10:16 na po. 10:22. Kung wala na po, pwede maano natin si Pastor Terry, Dr. Soniga para po sa ating closing prayer.
Okay. Our Heavenly Father, this evening we are so happy having a time listening the lectures about our subject tonight. And we are so grateful for the privilege of having Dr. Sal. I hope that you will bless each one of us as we go to our night slumber tonight, be able to wake up tomorrow and praise you and continue to our endeavor in life. Bless each one of us and forgive all our sins. In Jesus' name we pray. Amen.
Amen. So daghang salamat, Doc Jay.
Amen.
Thank you. Galing nga, sir. Thank you.